And I'm going to be a little sloppy with it here because I can be, and because I never like it to be too pretty. Once it's on, once it's on, I'll take that and sort of wipe it off that top surface. There we go. We'll add a little bit more. Some of the mistakes I see with blood a lot is way too much blood is used. Everybody wants to show off their blood skills, and they tend to add too much. And it's a fine balance. There's no right or wrong to it. Life can be pretty messy when it's bloody, so you want to capture that, but at the same time, you don't want to lose the design and the effect. That doesn't mean it's all about the sculpture and it's all about what you've created and everybody look at the cool little, scratch I did. However, you sort of lose the effect of what you're trying to achieve if you bury it too much. So this blood I'm using right now is the darker tone, so this is going to create some depth in the piece, and it'll sort of allow us to see the wound. And I usually start with something like this. I can take a little bit of water and I can clear up some of the outside stains here. There we go. And the great thing about the transfers is that they're really durable, so you can go in there and keep adding and subtracting and moving things around, and as long as your paint holds up, you don't have to go back in and refresh anything, or you don't have to worry about edges peeling up on you because you keep adding and subtracting. You can be pretty tenacious about how you apply this. Once that's sort of a place where I like it, I'm going to go in with another blood. This is more of a fresh blood, so it's a brighter red. Sorry about that. And this is going to allow us to have a little bit more of that current bleeding. Just going to kind of lay this in here. This blood actually will dry. I'm using another drying blood, but this one's a brighter red. And I'm doing this just for purposes of what might be used for continuity. And I can create some strands of blood coming down. Continuity is always a problem when it comes with blood, for one. Trying to get every smear, every drop the same, especially when you're doing a sequence that takes place within the same few minutes. It's one thing where you have to match and a few hours have passed and it's a little bit dirtier or whatever, but if you're shooting the same scene over a course of a day or two, it can be almost impossible to match. So a couple things to think about is your design of blood as you're applying it. Be specific about where you're placing it and how you're doing it so you can feel like you can repeat it the next day. Secondly, you kind of got to throw continuity out the window a little bit. You have to become comfortable with the idea that it's not going to be perfect, but however, blood does move, therefore it not being the same or perfect also can be helpful. See if there are elements you can tie in with it. Are they bloody? Were they in a fight? Are they sweating at this moment? Could that have helped move it? Is there dirt that can be added to it or around it? So there's a lot of things that you can use to your advantage, but you kind of have to know that going into it so you can plan on it and use that to your service, as opposed to, I'm just going to do this because it's cool and now I got to do 4 more days of it and I don't know how to copy it. We don't want that. So I think this sort of is a nice stopping point. We could always go bloodier with it and have it draining down the face, but I think this sort of shows off the prosthetic. I think it shows the wound nicely, and that's it. Simple. Thank you, Matt.
Thank you for wounding me.